Radiofrequency ablation differs from the DVR because it's not visualized. One puts in a needle next to a joint. The heated tip of the needle will then destroy a pain nerve fiber if it's close enough. But it was never visualized. One puts the needle where you hope that that pain fiber is. Unfortunately, it won't completely destroy that nerve fiber. It still has an insulation. Nerves grow back through that and then can re-innervate the joint, and then the pain returns. So frequently the pain will return in a matter of months. The procedure is either repeated or some other therapy is tried. The DVR, the direct visualized rhizotomy, we see the nerve fiber, we cut the nerve fiber, can't grow back, there's no insulation left. So it's a much more thorough procedure for back pain.